Good morning. Am I on? Am I on?
You are.
Hey, Jamie, stay here. Oh, you're going to go see her? Oh, that's okay. That's
Hi,
good. Give her a
James.
kiss, Jamie. Did you see Joe too? Did you get Joe too?
No, please don't do that.
Come on, baby. Lay down, Jamie. Lay down. Good boy. Good boy. I just wanted the dogs to do something cute because the only videos that people look on YouTube are dogs and cats that are doing weird things. But my dog is just sitting there like a good Irish setter. Where's Madeline, hon?
She's over on the
Oh,
counter.
here she comes. Got her coming in. Hello, Maddie. What are you doing? Are you going to do something sweet? Huh? You going to talk to Daddy? Will you say hello to Daddy? Can she say hello to you? They've got to do something good. Maddie, say hello to Daddy.
Say hello. Come on. Say hello. Yes. Say
Well,
hello.
she's a good girl. What can I do? They're good dogs and they don't do dumb things, so I can't really sell them. I can't sell my videos back. But I need you to, you who are watching, if you think it's a good idea of knowing the standards of care, please spread the word, because I told you in the beginning I want to change the world, and I'm 82 years old and I can't do it by myself. And it's a whole different view of hospitalization. It's not like Courtney said when she went in the hospital, you just walk in that door and you turn it over to the expert and that's it. You've got to walk in that door and be an interactive consumer with your care. And I really believe in that. So I'm just going to keep on saying this so someone says, hey, you know, that's a good idea. I'm going to do it. And spread the word, okay? Well, today I thought we'd talk about both catheterization and the administration of oxygen. Two very common procedures in hospitals, and you need to know what's done according to the protocols and the standards of care. Now, in most instances, if you go to surgery, you will come back to the ward, usually with a catheter in. And the reason that's in at that time, if you're not having urological surgery, is they want to measure your output. Is it 60 cc's an hour? There's a certain level that a person should produce and be safe. So they want to know that you are, until they take the catheter out, they want to know that your excretory system is working, you know. If you have urological surgery like a TURP, transurethral prostate
Resection of the
resection, if you have something like that, then you're going to have the catheter in for a while because there will be bleeding and it's work on that particular area. No one likes a catheter in. It's so embarrassing, and it's kind of, you know, we have our private area of our bodies, and this is private. You don't like to expose it. We don't like people to be aware of it. So a catheter is an outward sign of something's going on with one system in your body. So the whole process by the nurse should be done with respect and care, and recognize the psychological dimensions of having a catheter in. So if let's talk about insertion of a catheter on the ward. It might not be for you, but it could be for your mother, it could be for your sister, it could be for your husband, it could be anyone in your family. You all need to know the proper procedure, the way it's done. The first thing the nurse needs to do is let the patient know what they're going to do so that they can relax with the procedure, and they're going to tell them the steps of what they're basically going to do. And the first step is a real cleansing of the area. That's soap and water, really a good cleansing of the area. Patient can do it themselves, but it's got to be done well, because let's face it, that's an area that is dirty in the human body, and there's all presence of organisms down there. So a good washing of the area is essential. And then the nurse will come in to do the insertion. Now I got a catheter kit here. The funny thing about this, Joe, it didn't have a catheter in it. I bought it and I thought, well, this is great. Here's a catheter kit. I can show them that, but it doesn't have a catheter in per se. So I'll give you the details of how you go on, what you do first. Now the patient should be draped appropriately. They have bath blankets over both legs. Keep the covers over the patient when you're doing the procedure. keep privacy and modesty. Of course, the curtains over and, keep it very private. There is also the need for good lighting. Now with men, obviously, a catheter in the penis and it's direct and there's catheter guides. But with women, let's face it, the anatomy, the urethra and the vagina are very close together. So you don't want to mess around. You want it in the right spot immediately. You just go right in. So that's something to keep in mind when someone's putting a catheter. When they set it all up and that catheter is sterile, there's no fiddling around down there with the point of the catheter. It's at the spot, it's instantly in. Okay? So that's why people need good lighting. They need to know what they're doing. Experts, pros do it all the time. It's not a problem. But this is of concern. So let's see what's in this little catheter kit. There are a couple types of catheters. You're probably aware of that. There's straight catheters, which will be inserted, urine will be collected, and then it will be removed. The second kind of catheter what this kit is a Foley catheter. I'm just going to show you what's in here. Is a Foley catheter. It's got a balloon in it. Actually, it's inserted, and then the balloon is sterile water to inflate the catheter. Okay, so basically all of this is sterile. Okay, I'm holding it like I don't have gloves on, but it's got to be sterile. The other thing is they have their iodine swabs that you would use to clean around the area. There is some KY lubricating jelly that goes on the edge of the catheter to ease its insertion. Okay, there are a pair of sterile gloves because the procedure is sterile, so there is a pair of sterile gloves. And there is a kind of a sterile field that could be laid down so you could put your equipment on. It could also go under the bottom of the patient too. And I think that's right. And here's the important part of it too. This is a sterile drape, and you can see basically what it is. There's a spot. There's this kind of a bullseye, but basically it goes over, and this is where the catheter is inserted. So this is the kind of equipment that needs to be used to insert, and it's all come in this sterile container. Okay, so you prepare and you clean the area and you put the alcohol. It depends on the protocol of the place too. What is the protocol for an insertion of a Foley catheter? Might vary. The solution they use, the way they do it. But you got to understand that they have to do it meticulously and carefully, and they make sure that that catheter is sterile when it goes into the bladder. Okay, remember that. That's the key. Clean, sterile catheter in. Usually, I think I'll put, remember how I told you how to put on these gloves, the sterile gloves, and I will see my dominant hand is my right hand. So I'm going to put these on, and I'm going to show you what I'm going to do. Now these are isn't this interesting? These are kind of small for my hand. That's another thing. If you're going to use sterile gloves, obviously you got to have the right size. These are, I'm not doing it correctly, but I'm going to get them on anyway. There. Joe, that's really bad, isn't it? Look at it. If I was doing it sterilely, this would be done completely correctly. These are particularly bad. These are not good gloves. I'll tell you that right now. They're very small and they're hard to work with. They're not. If I wouldn't want to use these gloves. I'd use other sterile gloves. And remember, I go underneath. See, it's even hard. See how difficult it is. It depends on. It's even hard for me to get underneath here. See, there I am underneath it. This is sterile. Underneath is sterile. Now I'm going to try to go in. And look it doesn't open up well. This is very interesting because this is important. And if I'm struggling here, can you imagine someone that's bigger and larger? And look at that. See, this should go on very easy. I would not consider these a good pair of sterile. I wouldn't use these as sterile gloves because look at that. It shouldn't. It goes on. Last time I showed it to you, it pops on. Okay, so this is my dominant hand. okay? This is my non-dominant hand, and vice versa if you were left-handed. So when I take my equipment that's out here, when I take the catheter out, what I use this hand to open up the area, and I have the catheter in this hand, all scrunched up. Okay, see that? Non-dominant, dominant. I have the catheter in this hand. I've prepared the site. Everything is clean and sterile around it. I have good lighting. I take it and I put the sterile KY jelly on it. I'm ready to go. Ask the patient, take a deep breath, just relax. And I put the end in and I just insert it in. Quickly, just goes right in. It's all sterile and it's going in the urethra. Right, Joe?
Yeah.
Okay, I got it in, and now I'm going to put in, if a Foley catheter, I'm going to tape it to the side of the leg usually so it doesn't come back out again. It's got to be secure, and then I'm going to insert the sterile water to inflate the balloon that's in. Okay? So.
What are you going to do about the urine that's now pouring out?
Well, I have a sterile emesis basin there that the urine can go in, right? And I also could have a clamp that I clamp it all. Good point. Because if you're doing a straight catheter, you have something to collect the urine as it goes in, because that's what you want. With a Foley catheter, you absolutely, good point, Shelby, because that would be a disaster. Not a terrible disaster, but it'd be embarrassment to have that happen. So you want to collect the urine and you want it to be safe. So I might have a clamp, or I hold it tight and I put it in, and then of course you have the collection tubing, which is sterile, and you have the catheter bag, which you've seen on people, okay? You've seen those. So, anything else I forgot?
No.
Okay. So I've got the Foley catheter in. It's usually taped to the side of the thigh, and also then it's attached to the bag.
Or else it's attached to the bed.
To what?
To the hospital beds.
To the what, honey?
Hospital bed.
The hospital bed.
Yeah,
at the side of the bag. Yeah, it's attached. It's in the drainage bag attached to the bed. Okay. Now that's not the end of it, basically, because you got it in, and one of the major causes of infection in hospitals is catheters. You don't want that catheter in very long, and you got to understand what the procedure is. Do they irrigate the catheter to keep it patent? When do they change it? How many days is it left in? Okay. Keep the area around it very clean when it's in. Remember that the catheter bag, the collection bag, has to be lower than the body. So if the patient is transferred into a wheelchair, the catheter bag is set, might be clamped temporarily, and then it's set to the side. Don't leave the clamp on. It's supposed to be draining. You don't want the urine to go back up, okay? Once it's in the collection bag, even though that's a sterile procedure, it's not, you don't want anything to retroflow up into the bladder. Stretcher, make sure, don't put the catheter bag on the chest of the patient. Put it down to the side of the stretcher. Okay? Very important, the procedure. Courtney, ask me questions. I want to make sure I cover everything there. I think that it's a common procedure, but it must be done with care. Anything special you hear?
All I can think about is, because they're covering you up so much, you might not even be able to see what they're doing. So whoever's with you would sort of take on that role of stepping around.
Don't be embarrassed by, hey mom, look at, would you be at the bottom of the bed as I have the catheter put in? If you can. Yeah. If you can. Because it is a matter, and of course if you're not, if your mother isn't very much, if she has some problems with cognition, you really have to be, you're her advocate, and you have to be there, and you have to be watching. There are procedures, there's other procedures they can, catheters, Foley catheters are not a good idea. They have to be used. But if you can do other ways to regulate, say an elderly person in a nursing home, use some sort of adult a panty kind of thing on. Do anything you can, and don't call that a diaper. I'm telling you right now, don't you ever call those things that are used with elderly patients a diaper. It's an adult panty, it's an adult brief, I don't care what you call it, but I do believe that the use of that term is very derogatory. So your mother's in a nursing home, talk with the staff, ask what they can do besides a catheter. You know, because you want to protect them. And nursing homes are challenging. Maybe we'll talk about nursing homes one time, because I have a lot of thoughts about nursing homes. Okay, so, but that'll be down the road a little bit. But remember these kind of questions. Now, did I forget any questions, Joseph?
I have no idea.
You know me well enough to know. How do you maintain the sterility of the catheter? Let's see. Suctioning. Actually, here we go with catheters. I had, oh my goodness, I had 1, 2, 3, 4. I have over 10 questions, but I'll give you a sample. I might say to the patient, is it hard to handle all that equipment when you're doing a catheterization? Just to talk about, is there a dominant or not? Well, how do you know whether you use your right hand or your left hand? Am I going to have this catheter? Is it a straight catheterization? Do I have to have this done several times? My mother has an indwelling catheter in place. Is she more apt to get an infection? Good question. Always ask that question. How often will the indwelling catheter be changed, and do you irrigate it? Do you have procedures to keep the private areas clean to prevent infections? It's not simply putting it in and forget about it, all right? Do I need to do anything to make sure the indwelling catheter is draining well? You're sitting there with your mother and you notice the urine is very concentrated. The nurse should have picked that up, because that means probably there's not enough in the intake. If you ever see any blood in the bag, these are things that you need to, the nurse should know that. Can I walk around with my catheter bag? Should my mother drink more water since she has an indwelling catheter? What happens if the connection gets unattached? Okay, so you'd have to sterilize the end of the catheter, and you'd have to get a new collection bag that was sterile. Okay, did I forget anything, honey? Did you see anything in that?
No, it's fine.
Okay, let's move on to oxygen. Very common procedure in hospitals. I think we all know that oxygen is a volatile gas, that it supports fire. So you'll see if anyone has oxygen administration in the hospital, there'll be signs all around, no smoking. You know, hospitals are smoke-free anyway, but this was always a concern, that someone comes wandering in with a cigarette. So that has to be monitored. We now have the nasal catheters. Joe and I, of the era when you used to see people in oxygen tents, believe it or not, maybe no one knows that. Remember, Joe?
No, I don't remember.
You don't want to say how old you are? Okay. But there were oxygen tents, and the oxygen came in, but that wasn't a very efficient way of receiving oxygen. And it took a while for them to know about the nasal catheter that is put. You see people, there's a very common thing. And remember, while the nasal passage, it isn't sterile, it is a clean. When you put a catheter in, it should be done cleaning. You should look at the nares and make sure there's no exudate, you know, anything coming out, that it sores or anything like that. Exudate, right? So it's not something you just stuck it in and it stays in. The most important, and it's also the amount of liters they get, right, per oxygen. It's very important. I mean, there's some conditions like constructive pulmonary disease, COPD, that actually the carbon dioxide that they have in their system triggers respirations. And I remember learning this, that you have to be careful about how much oxygen they get so that you don't screw up the respiratory. Now don't quote me on that, but I know it's not, oh, that we just stick the oxygen in. It's how much they're getting, it's their condition, and they need to be monitored with it. Keep track of the respirations. Now they do the little finger check.
Yeah, it's a constant monitoring.
Yeah, they monitor what the oxygen level is. And the only other thing about that I want to talk about is the bottle in which the oxygen goes through. Usually it's on the wall and the oxygen goes through there. And the reason you have this is because oxygen is very drying. So they actually humidify it as it comes in. Okay, a little bit of moisture comes in. Just like in your home, if you have a humidifier, you know, there's water that's coming in for breathing. That bottle should be sterile. That should, I don't know what the hospital procedures, but that water should be sterile. Because, and how often do they change it? And these are things you need to know, because that bottle is a great place for germs to grow. You know what I mean? Fluid, you know. So what is it, right, Joe? I mean, we got different diseases, Legionnaires, and we got this new terrible fungus coming, that super fungus, you know, kind of, ugh. But I would think that would be a great site for that to grow. Moisture, warm, coming in to a closed passage. So I remember when we went on vacation and we had a air conditioning system that was blowing down on me. Actually, I swear I got Legionnaire's disease. I had the most awful respiratory problem. So just an aside, I'm giving advice. When you go on vacation, make sure that they clean the filters in the air conditioners. I'd ask that wherever I go. I want to make sure that I'm safe when I'm away from home. It's a simple thing, but you know, this is very important. So that's a little aside that I learned. What do you think, Joe? Is that a fair?
Sure, they're not going to pay attention to you, but
Well, then I would check these filters myself. I'm the kind of person that I would say, okay, when did this filter go in? Look in there and say, when did this filter go in? It doesn't look good. It's all full of gook. Okay, I can do that. You know me well enough for that. So, oxygen. Anything else in oxygen? Let me see what my questions. I have good questions. Catheters, oxygen administration. What is the flow rate of oxygen? How is it determined by the doctor? What would be the signs that my mother isn't getting enough oxygen? How much water needs to be kept in the humidifier bottle at all times? What type of solution do you use in a humidification bag? I'd say that. What kind of solution is that? Okay, so that's important. That's my big thing about oxygen. Anything else I'm forgetting? I think I'm forgetting something about oxygen. Anything there? Okay, 2 procedures. I don't want to start on central venous lines. That's a whole discussion. So that's going to be what I'm going to talk about next week. Anything else? I don't want to get off the track too much. I want to stay focused. Just spread the word. Please help me get out and get this message. I've just decided today, I didn't tell you this, Joe, but I'm going to take on our long-term insurance carrier. That's my new thing, because I'm a supporter of aging at home. So I want to find out how they set policy, these great big mammoth Aetna, Met. How do they set policy for their distribution of money? We've had long-term insurance for years. I bet we've had it for 30 years. We got it as a teacher. And I want to know how they make their decisions, because I think they have a major impact on health care. I don't want to go to nursing home. I want to be at home. So I'm following up on that. It's just an aside. I'm old, but I still want to make change. Okay? Goodbye. That wasn't a bird, was it? That was a leaf that fell. Okay. All right. We'll see you next week. Central Venous.